You've been trained to believe it's your fault you don't trust doctors. It's not. The healthcare system wasn't built to earn your trust. It was built to move patients through as quickly as possible. And if you don't understand how that system works, you'll keep leaving appointments frustrated, confused, and wondering if anyone is actually looking out for you. Here's the part almost nobody tells you. The people studying this at the highest level of American medicine have reached the exact same conclusion. Leaders at the National Academy of Medicine now argue that trust isn't a personal feeling you either have or don't have. It's an outcome produced by a system, built by some parts of that system, broken by others. By the end of this video, you'll understand the 4 biggest reasons trust in healthcare has broken down, the one thing that makes all 4 of them worse, and the single question you can ask at your very next appointment that instantly puts you back in control. I'm Dr. Sievers, a family medicine doctor. I grew up in Long Beach where the neighborhood clinic felt more like an assembly line than a place that cared about people. I remember watching families leave feeling unheard, confused, and defeated. Today, I sit on the other side of that exam table. After years of practicing medicine, I had to admit something that many doctors don't want to say out loud. The biggest problem isn't your doctor, it's the system your doctor works inside. Medicine has actually learned this lesson before. 25 years ago, a landmark report called "To Err is Human" changed how the entire field thought about medical mistakes. Before it, the assumption was simple. A bad outcome meant a bad clinician. That report reframed errors as failures of system design, and it launched the modern patient safety movement. We are now at the same turning point with trust, because trust isn't broken by one doctor, it's broken by design. Let me show you exactly how. The first reason trust breaks is money. Healthcare is one of the only industries where you often don't know the price until after you receive the service. Imagine ordering dinner and not finding out what it costs until weeks later. That's healthcare. When prices are hidden, your brain naturally starts asking questions. Do I really need this test? Are they recommending this because it helps me or because someone gets paid? That uncertainty destroys trust. And this isn't just a feeling. When researchers map out what actually erodes public confidence in medicine, one of the recurring culprits is systems that feel impersonal, hard to navigate, or driven by profit. Add in real or perceived conflicts of interest, who funded the study, who profits from this device, and the suspicion becomes the default setting. Notice what's happening there. You're not being paranoid. You're responding rationally to missing information. At your next appointment, ask, can you tell me what this is likely to cost me? And is there a less expensive option that works just as well? You deserve to know. Most physicians actually appreciate patients asking thoughtful questions. They might not know the answers because most of the docs don't know the cost of things, but they can ask their back office staff, or when you go in for the service, you can definitely ask that at a time. If you want to become a more confident patient, I've created a free guide with the most important questions every patient should ask before agreeing to tests, medications, or procedures. Grab it using the link below. The second reason trust breaks is time. You might wait months for an appointment, only to spend 7 or 8 minutes with your physician. It doesn't feel like healthcare. It feels like a conveyor belt. Here's what most people don't realize. Most doctors hate this too. We aren't paid to spend more time listening. The system rewards volume. That means many physicians are trying to deliver quality care while racing against the clock. And medicine has a name for what that does to us. It's called moral distress. Knowing what the right thing to do is and being structurally prevented from doing it. That matters to you more than it sounds like it should, because the research is clear that clinicians who have adequate resources, real support, and genuine professional autonomy are the ones best positioned to build trusting relationships with patients. Burn out the workforce and you don't just harm doctors, you degrade the single most reliable place trust actually gets built. Which brings me to the most hopeful statistic in this entire video. In national polling from 2025, about 85% of adults said they had at least a fair amount of trust in their own physician for health recommendations. Compare that to roughly 66% for the National Institute of Health and about 61% for the CDC. Read that again. The relationship is still working. It's the institutions around it that are struggling, which means the exam room is still the highest leverage room in American healthcare. If you know how to use your time with your doctor wisely. Before your appointment, write down your top 2 concerns. Then say them during the first minute, not the last minute, the first. That dramatically increases your chances of getting the answers you actually came for. The third reason trust breaks is history. For many communities, distrust isn't paranoia, it's experience. Course of sterilization programs, the Tuskegee syphilis study, Henrietta Lacks, whose cells were taken and used without consent, decades of exclusion from clinical research that shaped modern treatment. These aren't opinions, they're documented examples of medicine failing the very people it was supposed to protect. And here's what makes this a current issue and not a history lesson. The inequalities didn't stop. Researchers still document persistent gaps in maternal care, in how pain is assessed and treated, and in who receives respectful, high-quality care in the first place. And then layer stigma on top of it, patients living with mental illness, with substance use disorders, with infectious diseases, or in larger bodies routinely report being judged before being treated. And the predictable result is that people delay care, withhold information, or stop coming altogether. Research on medical distrust shows something important here, that distrust is remarkably durable, passed through families and communities, and reinforced every time a new experience confirms the old story. That distrust didn't develop overnight, and it won't disappear overnight either. Trust is rebuilt one honest conversation at a time, and it's rebuilt by institutions that acknowledge mistakes out loud instead of quietly moving on. If you've had a bad experience in healthcare, name it early, especially if you're meeting your new doctor. I've had experiences in the past that made me hesitant. I want to tell you what happened so we can start off differently. A good clinician will slow down. That sentence changes the entire visit. The fourth reason trust breaks is new, and it's moving fast. Technology. There is now an algorithm somewhere in your care. Something is helping decide which patients gets flagged, which risks get scored, which notes get written, sometimes which treatments get suggested. Some of that is genuinely good medicine, but it raises questions the system has not fully answered yet. Where does your health data go? Who else gets to use it? If a tool is biased against people who look like you, who catches that? And when a digital system gets something wrong, who is accountable? Concerns about biases, privacy, secondary use of health data, and weak governance are among the fastest growing threats in confidence in medical institutions. The lesson is simple. If a system can't explain how it made a decision about you, it can't expect your trust in that same decision. You're allowed to ask, was any part of this recommendation generated by a tool or algorithm, and did a person review it? That's not an anti-technology question. That's an accountability question. But here's what makes every one of those problems worse. Silence. When your treatment plan changes, when your doctor orders another test, when national guidelines changes, and nobody explains why, that's when trust dies. This is the thread running through all 4 lessons. Hidden prices are silenced about money. Rush visits are silenced about reasoning. Historical harm is silence about accountability. Algorithms are silence about how a decision got made. And notice how much of public health's credibility problem is the same failure at scale. Guidance on vaccination, masking, screening, quarantine that shifted without anyone clearly explaining what new evidence caused the shift. Changing your mind because the science changed is good medicine and good practice. Changing your mind without explaining why looks like something else entirely. Meanwhile, transparent, accessible, culturally responsive communication delivered by someone you actually trust shows up again and again as one of the strongest trust builders we have. At your next appointment, ask one simple question. Can you explain why in plain language? A physician who respects you will gladly explain. If they don't, that tells you something too. Here's what I want you to remember. First, hidden costs create suspicion. Ask about pricing before making decisions. Second, limited time creates disconnection. Lead with your biggest concerns in the first minute. Third, history is evidence, not paranoia. Name your past experiences so care can start differently. Fourth, technology without accountability breaks confidence. Ask who reviewed the recommendation, or if they're using like an AI tool for scribing, make sure you ask specifically how long it's staying stored for and what is it being used for. And above all, silence destroys trust. Always ask why. Now here's the bigger picture. Trust in healthcare isn't one relationship. It's a whole system. Your doctor, your insurer, your hospital, public health agencies, the technology in the background, and the information environment you scroll through at midnight. Gains in one area reinforce the others. Failures in one cascade into all of them. Which is why no single institution can fix this alone. It has to be earned across the board through transparency, accountability, and actually listening to the people being served. You are not a difficult patient for asking questions. You're an informed patient. An informed patient makes better healthcare decisions. If this video changed the way you think about healthcare, subscribe because every week I pull back the curtain on how medicine really works and how you can become your own best advocate. Leave a comment below. What's one question you've always been afraid to ask your doctor? I read every single one. And watch this next video right here on the hidden cost of delaying care. It can completely change your life. I'll see you in the next one. Peace.